All right, so when you're dealing with medial knee pain, there can be a lot of reasons for it. But if you're having knee pain on the inside of the knee, on the top edge of the shin bone here, many times this comes from what's called the pes Anserine group. So this is a tendinous attachment point for three muscles that come down from the hip that are traveling along your thigh. And these muscles do a lot of things, but one of their primary goals is to decelerate or slow down rotation that happens at the knee. So if you are catching or throwing a baseball, sometimes there's torque, rotation that happens through this knee joint. So these muscles help to decelerate that motion. So to hit those, first one is going to be the sartorius. This muscle is traveling from the hip bone here, traveling, looping around from the front, going diagonally, then swooping around and then attaching at this point on the inside aspect of your shin bone at the top. So to get that, I'm going to find about the center of my thigh. I'm going to go in at about a 45 angle and take my forearm across using the blade of my forearm right here. So it should be pretty bony. Then I'm just going to press in and hold pressure, maybe for about 10 breaths. And I'm just hanging out, holding pressure. And then I can move my arm up or down my thigh along this kind of oblique angle, going from the top of the thigh down towards the bottom of the thigh, and just following that path, holding pressure. And I'm just looking for any kind of very sensitive spot. Next one is going to be the gracilis. This is a muscle going from the pelvis about here, traveling all the way down, again attaching right here at the insertion point. For this one, I'm just going to take my elbow, right angle, find that little point right there. I am blessed with pointy elbows. And then I'm just going to super gently press in. Notice how I'm in the direct center of the adductor group here. I am not in the groin region here. So I'm just going to press through there, hold pressure. Again, I'm just going to move up and down, holding each spot for about 5 to 10 breaths. So I'm still breathing the entire time. Last one is going to be the inside hamstring here, specifically the semitendinosus muscle. But all that we have to do is think about it as the inside hamstring. I'm going to take this ball, I'm just going to place this ball under that inside hamstring, press down, and then hold pressure. So I'm pressing down with my hands as well as the weight of my leg. I'm just gently holding pressure. With this one, you might have to move that ball around a little bit until you find a relatively gnarly spot. So on the second one, I found a better spot for this. Again, I'm just holding in pressure for 5 to 10 breaths. If you have an acute or tender point right here on the front inside aspect of your knee, then it's likely that doing some jumping motions or some rotating motions or throwing motions involving torque or tension through this knee joint is causing the irritation. So an easy initial thing to do is to hit these three muscles. Again, sartorius traveling this way, your gracilis traveling down the inside thigh, and lastly that medial hamstring here, hitting those guys. And then also complementing that with some single